This presentation will cover what a stroke is, the early warning signs of a stroke, and how to use the acronym BE-FAST to detect the signs. Did you know that in the United States, one person dies of a stroke every 3 minutes and 14 seconds? This information is provided by the American Heart Association. Stroke Statistics Update of 2024. According to the World Health Organization, every year, 15 million people suffer of a stroke. So if you think that by leading the healthiest lifestyle, eating that healthiest diet, exercising every day, abstaining from alcohol consumption, by not smoking cigarettes, and by sleeping in early, you can still be affected by a stroke. If one of your loved ones is affected by a stroke, you will be affected by the stroke as well. By recognizing the signs of a stroke, you can make a difference in a person's future. You do not need to be a medical professional to be able to know when to act and be fast. As a registered nurse, and from my professional experience, I can attest that strokes do not discriminate. I have had patients between the ages of 25 to 90 who have suffered of a stroke. Some, the ones who received prompt medical treatment, recovered with ease, whereas the others who did not act fast and did not receive prompt medical treatment suffered with permanent damage. Do you know what a stroke is? According to Johns Hopkins Medicine Journal, a stroke will come or present itself in one of two forms. The first will be an ischemic stroke. In the ischemic stroke, a vessel within the brain will become occluded. Through that occlusion, the remainder of the vessel will be deprived from oxygen, therefore causing death of tissue, in the medical field known as ischemia. In the second type of stroke described by this journal, we have a hemorrhagic stroke. Hemorrhagic strokes mean that that vessel breaks open, blood is released, and whatever blood is out of the vessel and into the brain tissue damages it, therefore leading to damaged tissue and blood loss. What are the warning signs to a stroke? According to the Mayo Clinic, one of the signs includes numbness or weakness, primarily to one side of the body. The second will be changes in the vision. This also refers primarily to one eye. One eye can start becoming blurry. They might lose sight of one eye. And like I said, this is the second symptom. Thirdly, we have trouble speaking. Slurred speech is one big telltale that somebody is undergoing a change in their brain. Fourthly, we have a severe headache, especially with any type of the strokes. The patient will suffer of a severe headache, and this won't be a migraine. They will know the difference that this headache is intense. At symptom number 5, we have trouble walking. You may think that maybe grandma is walking a little bit clumsier and is constantly tripping over nothing. That may be a symptom and recalls for prompt attention. Goldstein's acronym of BE-FAST will be able to help you remember all of the signs and symptoms to detect a stroke and be able to better help out whoever is suffering the symptoms. Firstly, we have the B. This is balance. If you are able to tell that your patient cannot hold their balance, leaning forward to one side, that is a symptom. E stands for eyes, and we go back to referring to the vision and the loss of sight, primarily of one eye. F refers to face. Here you will be able to tell if a patient is having a change in the symmetry of their face. You'll be able to tell if there is drooping of their mouth, drooping of the eyelid. A stands for arms, and this again ties in with balance. You will be able to see a drift in the arm despite them thinking that they're holding both at the same level. S stands for speech. Once again, undergoing a stroke will lead the patient to slurred speech or maybe answering incorrectly, depending on what side of the brain was damaged. And most importantly, we have T, which is time. Time is of essence here. The faster you act, the sooner this person can get treatment, and hopefully the damage done will not be permanent. Now you know what a stroke is. You also have the information to tell if somebody is having a stroke. This could be yourself or a loved one. You possess the knowledge now to know when to be fast.